السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء وسيد المرسلين. This is Dr. Taher Kharier. I'm palliative care consultant. On behalf of Saudi Palliative Care Society, it's my deepest pleasure to welcome all of you for this important session, and today we will talk about the last days and hours. So we hope that we get utmost benefits from the lecture, and let's start. Bismillah ar-Rahman ar-Rahim. In this module we would like to know how to prepare ourselves for the last hours. So we have to make sure that the family are prepared, especially to ensure that advanced directives are in place, especially the DNR order. Make preliminary funeral arrangements and educate the family. For example, tell him what to expect as the end nears, and explain signs and symptoms for the imminent death. For example, special breathing pattern called Chinese stop breathing, skin muffling, and loss of consciousness, and to tell the families and caregivers who to call when the patients die. There are special circumstances we need to focus on and prepare the family if the patients are at risk for massive bleeding, and there are special situations we have to consider, especially when the patient has large neck mass invading the large vessels, prior episodes of hemoptysis and upper GIT bleeding and rectal bleeding. It's vital to prepare the families, and this can be very distressing. So we have to recommend to use dark towels. Make sure the subcutaneously midazolam available all the time, and direct the patient to place on one side if the massive hemoptysis occurs, and do not call 911 and panic. If the patient unable to swallow, we have to prepare for alternative administration routes for essential drugs. So there are multiple routes we can use other than the oral. For example, we can use the subcutaneous routes to give medications such as opioids, haloperidol, dexamethasone, and etc. We can use per rectum routes to give morphine, methadone, suppositories, sodium valproate, and or diazepam. And we can use also the transdermal patches, for example, buprenorphine or fentanyl patches. And finally, we can use the sublingual tablets, for example, fentanyl. For the subcutaneous medication, we have to insert special type of needle. It's called indwelling subcutaneous butterfly needle. Death rattles. The death rattles is a gurgling on or rattling noises as a secretion boiled in the oropharynx or bronchi. It's very distressing to observe and occurs in the last hours of life. On examination, we can find that we can hear transmitted sounds from upper airway, but there is no crepitation or crackles in the lung, which is founded mostly in end-stage pulmonary edema. What we can do for patient with death rattles? First and most importantly, we have to reassure the family and visitors that choking is unlikely. Try gently to give oropharyngeal suctioning, and avoid too deep or frequent suctioning. In the severe cases, we have to consider to give medications. most of family are reassured with an explanation. So simple explanation is very vital in this situation. The pharmacological management, there is a varieties of medication that we could use. So scopolamine subcutaneously can be given, and glycopyrrovates both subcutaneously and intravenously could be a choice. Atropine, it can be given also as a management for patients with death rattles. But in this medication we have to avoid the prolonged periods of time because they will worsening the delirium or agitation. End-stage pulmonary edema, some patients developed this clinical presentation, and you can find in examination there is a crackles and crepitation throughout the lungs. There is similar sign and symptoms to patients with acute respiratory distress syndrome. Discontinue any artificial hydration is a very important option to avoid the worsening of